Hi, I'm Tom Lathan. Welcome to another edition of Community Highlights Online, a look at the programs, services, and people of Sunnyside Community Hospital and Clinics. The subject today is cardiac stress testing, and the guest is Tom Andersen, a respiratory therapist who works with our internal medicine physicians when a patient needs a stress test.
Patients come here because they visited their physician and they felt some kind of chest pain, chest discomfort. Some will feel sweaty and dizzy. There's lots of different cardiac signs that are out there, but a physician will send you here to rule out, is it your heart that's actually causing this pain, or is it something else?
Generally speaking, patients are 18 years of age or older. Andersen said he has tested patients into their 80s. If you think this is just about we guys, well, guess again.
It's not just about men. Women increasingly are having a lot more cardiac problems out there. In fact, with women, they're more of a silent cardiac problem. That's why they're looking into them a lot more. They don't realize the symptoms that they're having, and some of the symptoms that they have are what they would consider on the light side. And if you're a busy woman, there's a lot of things in your life and a lot of things going on, and a minor little pain is something that you're used to dealing with a lot, especially if you've got kids and a marriage and job and all those things piled together. It's real easy for a woman to overlook a minor little pain.
A cardiac stress test or an echocardiac stress test requires an order from your primary care physician or your cardiologist. Steps are taken to test your heart in a safe environment, and as Andersen explains, there is some work involved in your part. So does it hurt?
Does walking up a slight hill hurt? If you exercise, it shouldn't hurt at all. Unfortunately, probably 80% of the people that come in here don't exercise. And yes, you're going to feel the exercise portion of this. No, there's no needles involved. No, there's no chiropractic cracking going on. What we want to do is take your heart from a resting heart rate and in a controlled atmosphere, slowly increase that heart rate so we can monitor it on a screen and look for specific changes. If you have blockages, if you have something going on in your cardiovascular system that's not normal, it should show up during this test. Echoes are just like the machines they use to look at babies and moms, like an ultrasound. Only here it's specific for the heart. So when you come in and I hook you up, the first thing we do is look at your heart on the echo machine. He can take measurements of wall thickness and all kinds of different things inside the heart while it's in a resting state. Then the doc comes in and we get you on the treadmill and slowly stress your heart. Shoot for a target heart rate, which is different for each person, but it's up there. You're moving right along on that treadmill. When we reach that target heart rate, I get you off the treadmill, back to the bed as fast as we can, so the echo tech can again take a quick 60-second look at your heart under stress. Cardiologist gets a slow heart and a nice stress heart to compare. Is everything working the same under stress as it is when it's relaxed?
Many patients will have an echocardiac stress test, and as Andersen explained, it gives the doctor more information, and together the two tests provide more accuracy.
Correct. In what they call the olden days, we used to just do treadmill tests. I would get you in, hook you up, just walk on the treadmill and watch the monitor and see if anything happens. But they found out that that test is only about 77% accurate and catches 7 out of 10 probable heart problems that are out there. If you're the patient, you want that 90-some percentile bracket. So by adding the echo portion, that's what brings that percentage up.
I've had a cardiac stress test twice actually, and I can guarantee you it's better to have the information than it is to worry and wonder, is there something wrong? So if your doctor orders a cardiac stress test, you can count on Tom and other members of our respiratory care and cardiac team to be there to care for you.
To help with the stress level, we've added a TV screen, and patients have a choice of during the test whether they want to walk in Italy or London or a rainforest in Hawaii. And that helps bring that stress level down. We've also added a small air conditioner. When you're slowly walking up Mount Rainier and you're already stressed, you're going to work up some sweat. and that can be very uncomfortable. So anything we can do to relieve that stress from the patient, we've tried to add here.
Thanks for watching. Please click on any of our other healthcare features if you have questions, but never substitute anything you hear or read for an appropriate examination by your physician or other primary care provider.